If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question: what is the science behind type 2 diabetes in terms of prevention and treatment? Answer by Mar Farhat. The causes of diabetes type 2 are combinations of lifestyle and genetic factors. We can't modify genetic factors, but we can modify lifestyle. Lifestyle factors are important to the development of type 2 diabetes, including obesity and being overweight, body mass index of greater than 25, lack of physical activity, poor diet, stress, and urbanization. Excess body fat is associated with 30% of cases in those of Chinese and Japanese descent, 6,080% of cases in those of European and African descent, and 100% of cases in Pima Indians and Pacific Islanders. Among those who are not obese, a high waist-hip ratio is often present. Smoking appears to increase the risk of type 2 diabetes mellitus. Dietary factors also influence the risk of developing type 2 diabetes. Consumption of sugar-sweetened drinks in excess is associated with an increased risk. The type of fats in the diet are important, with saturated fats and trans fatty acids increasing the risk, and polyunsaturated and monounsaturated fat decreasing the risk. Eating a lot of white rice appears to play a role in increasing risk. A lack of exercise is believed to cause 7% of cases. Persistent organic pollutants may play a role. Prevention: proper nutrition and regular exercise. Intensive lifestyle measures may reduce the risk by over half. The benefit of exercise occurs regardless of the person's initial weight or subsequent weight loss. High levels of physical activity reduce the risk of diabetes by about 28%. Evidence for the benefit of dietary changes alone, however, is limited, with some evidence for a diet high in green leafy vegetables and some for limiting the intake of sugary drinks. In those with impaired glucose tolerance, diet and exercise either alone or in combination with metformin or carbos may decrease the risk of developing diabetes. Lifestyle interventions are more effective than metformin. While low vitamin D levels are associated with an increased risk of diabetes, correcting the levels by supplementing vitamin D3 does not improve that risk. Answer by Lisa Stansberry. 2 things: 30% more sugar packaged in our food supply, and people who don't have bodies that can process all that sugar. Our food supply has become flooded with sugar, which has exposed to latent metabolic vulnerability in an awful lot of people, says Dr. Tim Church, a researcher with the Pennington Biomedical Research Center. Example: from 1977 to the present, the amount of added sugar we consume has soared 30%, and our metabolism is losing its ability to process the ions. Submit lot. LSU's Pennington Biomedical is posting a lot about research trials etc. If you are interested, Pennington Biomedical Research Center.